Yeah, so there are a handful of outcomes that we really wanted to focus on back in 2020 when we started this, and one was patient satisfaction. We knew that this would be important for COVID, but even post COVID world, home infusion is a great option for people. Not having to travel to the facility and to be able to get care in your home for many people can be a great from a convenience factor. So one of the things that we looked to measure was the patient satisfaction of people who have gone through this program. So we created a survey, and at the high level summary is that there was a 98% patient satisfaction score. So patients liked it. It was well received. People were getting their first infusion at the facility, so you're assessing the tolerability there. And when patients were candidates and they could be safely moved, people appreciated it, and the provider satisfaction was strong as well. Overall, it's well received by providers. Identified along the way some areas for process improvements, but overall was well received by both providers and patients. And some of the other outcomes that we looked at were kind of clinical and safety outcomes, and we wouldn't expect any clinical differences, but or even safety differences if they're getting their first infusion in the facility. You've kind of assessed some of that. But we did not see, to any appreciable degree, patients going from home back to the facility. Obviously, there always is a possibility, but we didn't see that. We also looked at the from a facility end. One of the things that we looked at as well was really freeing up capacity for them to treat other patients. And so if we look at just those 61 patients that were moved for 2023, that would represent an estimated 290 visits for CI&J that allows them to fill an extra 1 to 2 treatment slots per day. So it allowed them to kind of backfill for some of these more complex patients. From a financial perspective, one of the things that we looked at as well, although I will say that the cost savings was not a primary outcome of what we were looking to see. We knew that would likely follow with facility costs, drug costs, and administrative costs being higher, but that was really more of a secondary outcome. And we did see cost savings as well. So for the first 40 Horizon members that we measured, had the follow-up data pre and post, there's about $1 million in savings, plan paid savings, and that represents about $25,000 per patient in the program. So certainly that was a positive outcome as well. Certainly, that was one of the first things that as we were talking about this, that came up. And you're right, it's been a pilot, a handful of people, right? Relatively small dollars, but we knew from a cost perspective that hospital administrative drugs represents revenue for the facility. So it's one of the things that we certainly talk through and work through. What I would say is that from the perspective of the program, certainly helped that the facility and the home provider Qualitas is part of that broader network. So the dollars are still staying kind of within the ecosphere of the hospital system. And one of the things that we talked through within one of the work streams of contracting is to say, what would it look like kind of post pilot in a model that would benefit both parties. So that could be developing some type of episode of care program, some type of shared savings program that would make it amenable long-term for both Horizon and the facility. One of the things kind of happening in parallel of the pilot, kind of separate from the program, but still happening in parallel, was work to recontracting work with the facility. So one of the things that we talk about in the session is that there was movement of the facility over to kind of recontracting the drug rates to align to CMS rates, so align to say the Medicare allowable rates. And so what that did was that went into effect 1/1/23. What that did was really remove that financial, let's say, cost difference of drug in facility versus drug in home, because they're now being reimbursed for drugs at the Medicare allowable rate. There's really not that big cost difference. So we kind of talked through very early on what a shared savings program may look like, an episode of care program may look like. In the end, we really didn't need that because there was kind of this better alignment of drug costs in the facility. So, I mean, the savings that we saw in the program were with the first 40 Horizon members that started in 2020. And what we looked at was what were the costs 6 months before in the facility versus 6 months in the home, and annualize that out. And that was based on the drug and administrative costs. And so those were real dollar savings. Now, if we compare those that converted in 2023, it's true there would not be you would not expect any appreciable difference in cost, because they went from facility where now they're at the Medicare rates to home, which is going to be maybe a little bit above the Medicare rates, but it's going to be pretty comparable. So from a cost savings perspective, we saw some of that savings prior to 1/1/23. Wouldn't expect to see it kind of post 1/1/23.